9 warning signs you have toxic kidneys. Your kidneys are your body's natural filters. They remove toxins, balance fluids, regulate blood pressure, and even help make red blood cells. But when they start getting toxic due to poor diet, dehydration, medications, or chronic stress, your body will send subtle warning signs that are easy to ignore or confuse with something else. In this video, I'll tell you 9 warning signs you have toxic kidneys, from changes in your urine to brain fog, unexplained fatigue, swelling, and even a strange taste in your mouth. I'll break down how each symptom is connected to your kidney health in a way that's easy to understand and hard to forget. If you notice any of these signs, don't wait and talk to your healthcare provider. Catching kidney trouble early may save your life. And stay tuned till the end because I'll also share 5 powerful foods that may help protect your kidneys naturally. Now, let's get started. 1. Puffiness around the eyes. Waking up with swollen, puffy eyes might seem harmless at first. But if it keeps happening day after day, especially when you're well rested, it could be one of the first quiet warnings from your kidneys. One of their main jobs is to keep protein inside your blood where it belongs. But when your kidneys become toxic and their filtering units, called glomeruli, get damaged, they start leaking protein into your urine. This process is known as proteinuria. Now here's where it connects to your eyes. When you lose too much protein, the balance of fluid in your blood shifts. That change causes fluid to leak into the soft tissues under your eyes, making them appear puffy. It's not just cosmetic, it's a red flag that something deeper is off. Another reason this swelling shows up is that your kidneys regulate salt levels. If they're not working properly, they may hold on to sodium instead of flushing it out. More sodium means more water retention. And where does that extra fluid go? Straight into areas with loose skin, like under your eyes. It builds up there easily and gives you that tired, swollen look, even if your energy feels fine otherwise. According to Science Direct, chronic kidney disease may cause puffy eyes and blurred vision due to fluid buildup and damage to the tiny blood vessels in the eyes. These early signs may indicate kidney dysfunction. 2. Foamy urine. Ever noticed your urine looking unusually foamy or bubbly, almost like the surface of a beer or seawater? If it's happening once in a while, maybe it's just a forceful stream or a quick flush. But if that foam sticks around and becomes your new normal, it could be a subtle but serious warning from your kidneys. Normally, urine is pale yellow and relatively clear. But when your kidneys become toxic and their filtration barrier gets compromised, important proteins like albumin start slipping through into your urine. This excess protein reacts with air and causes those persistent bubbles. Think of it like shaking a protein shake. The more protein, the more froth. And in your case, that froth is coming from something that should have stayed in your bloodstream. Now here's another reason this happens. When kidney cells are inflamed or stressed from toxins, they may also let waste molecules like urea or creatinine pass through in excess. These substances alter the surface tension of urine. This disruption in chemical balance increases the likelihood of foaming because urine becomes more concentrated and irritative. The denser the urine, the more likely it is to foam, especially if you're not staying hydrated or your body is holding onto toxins that the kidneys should have cleared out. According to CJASN, foamy urine may signal kidney disease, usually from protein in the urine. However, it may also result from bile salts, amino acids, or concentrated urine. 3. Lower back or side pain. If you've been dealing with a dull, nagging pain in your lower back or just beneath your ribs on either side, and it doesn't seem to go away with stretching or rest, your toxic kidneys might be trying to get your attention. Inflammation of the renal capsule, the outer covering of the kidney, is a common cause of this pain. When your kidneys are under toxic stress from things like high sodium intake, excess medications, or buildup of metabolic waste, inflammation builds up inside. This puts pressure on the capsule, which is rich in nerve endings. Unlike internal kidney tissue, this outer layer may actually send pain signals. That's why even a minor swelling inside the kidney may feel like a sharp or dull ache in your back or sides. In addition to that, the development of kidney stones is another important component. When toxic substances accumulate and crystallize, especially calcium oxalate or uric acid, they may clump together into hard stones. These stones may block the flow of urine, stretching and irritating the sensitive inner structures of the kidney. The result? Intense, radiating pain that may start in your side but travel down toward your groin. This pain often comes in waves, and no matter what position you try, it's tough to find relief. That's because your body is reacting to internal pressure and damage that simple rest won't fix. According to the National Library of Medicine, kidney stones often cause sudden, sharp pain in the lower back or side, called renal colic. The pain may come in waves, spread to the lower abdomen or groin, and may be joined by nausea or vomiting. 4. Metallic taste in the mouth. Have you ever had a strange metallic taste in your mouth that just wouldn't go away, no matter how much water you drank or how carefully you brushed your teeth? If it keeps happening, it might not be something minor like spicy food or bad dental hygiene. It could actually be your kidneys sending you an early warning. One major cause behind this metallic taste comes from how toxic kidneys affect red blood cell production. Healthy kidneys release a hormone called erythropoietin, which helps your body make red blood cells. But when kidneys are impaired, this hormone drops, leading to anemia. Now, anemia reduces the oxygen-carrying capacity of your blood, which alters how your taste buds function. That's why food may start tasting off, bland, or like metal. Your tongue is literally starved of a proper oxygen supply, and your sensory perception gets thrown off balance. Moreover, inflammation and the subsequent immune response are also culprits. When waste products build up in the blood, the immune system reacts by releasing inflammatory cytokines. These chemical messengers don't just affect your organs. They also interfere with the nerves responsible for taste and smell. This is why some people with kidney dysfunction start noticing not just a metallic taste, but also a general loss of appetite or even a strange smell to foods they used to love. It's not in your head. It's your nervous system reacting to internal chemical changes caused by poor kidney function. According to the Journal of Renal Nutrition, dysgeusia, altered taste, is common in chronic kidney disease, affecting up to 35% of patients. It's caused by high urea, sodium, and potassium in saliva, zinc deficiency, and medications. This metallic or reduced taste may lead to poor appetite and malnutrition, worsening kidney health. 5. Dry and itchy skin. When kidneys become toxic and overloaded, they start falling behind on their job of filtering waste and maintaining the right balance of minerals in your blood. One of the first places that imbalance shows up is your skin, because it's your largest detox organ and incredibly sensitive to changes inside your body. The accumulation of too much phosphorus in your bloodstream is a major contributor to this. Healthy kidneys flush out phosphorus through your urine. But when they're not working properly, phosphorus accumulates and reacts with calcium in your blood, forming sharp crystals that deposit under the skin. These microcrystals may irritate nerve endings and trigger constant itching that no amount of scratching may soothe. This condition, often referred to as calciphylaxis or uremic pruritus, is common in people with long-term kidney disease. Apart from that, the toxic kidney's diminished capacity to maintain skin hydration is another important factor. Normally, your kidneys help maintain the right level of water and electrolytes, which support skin moisture from the inside out. But when they begin to fail, you lose that internal hydration balance. The result? Your skin starts drying out from beneath the surface, becoming flaky, tight, and more prone to irritation. It's not the same as having dry skin from the weather. It's a deep, persistent dryness that feels like it's coming from within. According to MDPI, kidney disease-related itching affects many dialysis patients and is caused by toxin buildup and nerve changes. Itching is often severe, disrupts sleep and mood, and lowers quality of life. 6. Frequent urination at night. Frequent urination at night, what doctors call nocturia, isn't just about drinking too much water before bed. It could be one of the earliest red flags that your kidneys are becoming toxic and aren't working the way they should. How toxic kidneys impact your body's regulation of hormones, especially the antidiuretic hormone, controls how much water your body holds onto. In a healthy system, ADH increases at night to prevent excessive urination. But when the kidneys aren't functioning well, they become less responsive to this hormone, or they trigger changes that lower its effectiveness. That means your body continues producing urine at the same pace during the night as it does during the day, making it nearly impossible to sleep through the night without getting up to relieve yourself. There's also the issue of fluid retention during the day. When your kidneys can't eliminate sodium properly, your body holds onto fluid, especially in your lower legs and feet. As you lie down to sleep, that fluid shifts and gets redistributed, making its way back into your bloodstream and toward your kidneys. Since your body is no longer fighting gravity, this sudden increase in circulating fluid pushes your kidneys to work overtime at night, leading to more urine production while you sleep. That's why people with toxic kidneys often find themselves fine during the day, but constantly interrupted at night. According to PubMed, people with chronic kidney disease often wake up at night to urinate, a condition called nocturia. It may be caused by fluid buildup, kidney damage, or certain medications. 7. Mental fatigue or brain fog. Toxic kidneys don't just affect your body. They impact how clearly you think, how alert you feel, and even how fast your brain processes information. When your kidneys can't filter properly, waste starts building up in your bloodstream. And eventually, some of that waste crosses into your brain, slowing everything down. Accumulation of nitrogen-based waste products, such as urea, is a major contributor to this fogginess of mind. Normally, your kidneys clear these out efficiently. But when they're under toxic stress, these compounds build up and start affecting how your brain cells communicate. The result is slower processing, scattered focus, and a feeling that your thoughts are heavy or stuck. It's not psychological, it's a physiological change caused by toxins reaching your central nervous system. Additionally, chronic inflammation is a factor. Toxic kidneys release inflammatory chemicals that circulate throughout the body, including the brain. These substances interfere with neurotransmitters like dopamine and serotonin, which are critical for alertness, memory, and emotional stability. As inflammation affects these signaling pathways, your brain's chemistry changes, leading to clouded thinking, low motivation, and emotional fatigue that's tough to explain. According to KJIM, chronic kidney disease may deeply affect the brain, causing issues like memory loss, anxiety, and depression. This happens because kidney damage increases inflammation, uremic toxins, and vascular stress, all of which interfere with brain function. 8. Shortness of breath. Toxic kidneys don't just affect your urine or your back. They may quietly impact your lungs, your blood, and your heart, all of which play a direct role in how easily you breathe. When they stop clearing waste properly, the entire balance of fluid and oxygen in your body begins to shift, making breathing feel harder than it should. Lung fluid accumulation is one of the most prevalent causes. When kidneys are damaged, they can't remove excess fluid effectively. That fluid begins to back up in the bloodstream and eventually seeps into the tiny air sacs in your lungs. It creates a condition called pulmonary edema, where the lungs literally become heavy and waterlogged. Breathing becomes shallow, fast, and strained, not because your lungs are weak, but because they're being drowned from the inside by fluid your kidneys were supposed to eliminate. Moreover, low red blood cell production is associated with another factor. Healthy kidneys produce a hormone called erythropoietin, which tells your body to make red blood cells. But when your kidneys are toxic, this signal weakens, leading to anemia. Without enough red blood cells, your blood can't carry as much oxygen, and your tissues, including those in your muscles and brain, start to feel deprived. Your lungs respond by working harder, trying to compensate, even when there's no real air shortage. That's why you feel breathless, even when your oxygen levels might look okay on paper. According to MDPI, chronic kidney disease affects over 800 million people and may also harm the lungs. It disrupts fluid balance and blood flow, causing breathing problems like congestion and lung vessel damage. 9. High blood pressure. If your blood pressure's been creeping up and no amount of diet changes or medication seems to bring it down, your toxic kidneys might be the missing piece of the puzzle. The renin-angiotensin-aldosterone system is a major hormonal pathway by which toxic kidney disease increases blood pressure. When your kidneys are under stress or perceive a drop in blood flow, even if there isn't one, they respond by releasing more renin. That kicks off a hormonal cascade that tightens your blood vessels and signals your body to hold onto more sodium and water. The result is an increase in blood volume and vessel pressure. And if this goes unchecked, the constant high pressure starts damaging both your blood vessels and your kidneys even further, creating a vicious cycle. Furthermore, fluid overload is another important component. Kidneys are responsible for clearing out excess water from your bloodstream. But when they're not filtering properly, your body starts to retain fluid, raising the total volume of blood being pushed through your arteries. The more fluid you have circulating, the more pressure it puts on your vessel walls. And that persistent force doesn't just elevate your blood pressure, it also makes your heart work harder over time, putting you at risk for heart failure and other serious conditions. According to the National Library of Medicine, a large Korean study found that people with high blood pressure had a higher risk of kidney cancer. Over 8 years, those with hypertension, especially those on medication, were more likely to develop the disease. Moving on, let's discuss 5 foods that may help revive your kidneys naturally. If you've ever felt bloated or fatigued or noticed changes in your urine, your kidneys might be crying out for help. I know how easy it is to overlook the warning signs. But the truth is, your kidneys work non-stop to filter toxins from your body, and when they're overwhelmed, so is your health. That's why I want to share 5 powerful foods you may start eating today to give your kidneys the support they deserve. You don't need to overhaul your entire diet. Just a few smart additions may make a world of difference. 1. Red bell peppers. These bright veggies are low in potassium but rich in antioxidants like vitamin C and lycopene. They help fight inflammation and reduce oxidative stress, 2 key issues that worsen kidney damage. Plus, their crisp texture adds a satisfying crunch to any dish. 2. Blueberries. Packed with anthocyanins, blueberries help shield kidney tissues from inflammation and cellular damage. They're also low in sodium, phosphorus, and potassium, making them ideal for people with compromised kidney function. 3. Garlic. More than just flavor, garlic offers sulfur compounds that protect the kidneys from heavy metal toxicity and oxidative injury. It also supports better blood pressure control, which is critical for kidney health. 4. Cauliflower. This cruciferous powerhouse is rich in compounds that neutralize toxins and help your liver and kidneys detox naturally. It's also a great substitute for high-potassium starchy foods like potatoes. 5. Cranberries. These small berries contain proanthocyanidins that prevent harmful bacteria from sticking to the urinary tract lining. This reduces the risk of infections that could further burden already strained kidneys. Toxic kidneys rarely scream for help, but they do whisper. I've learned that if you pay close attention, your body always tries to warn you before things get worse. You might feel fine on the outside, but inside, your kidneys could be struggling. If you notice more than one of the symptoms I just shared, don't brush them off. I'd suggest you get a simple blood test to check your creatinine and urea levels and a urine test to see if there's protein leaking out, because that's one of the first signs something's off. I'm not saying this to scare you, but to help you act early. Your kidneys are incredibly strong and may bounce back, but only if you and I don't ignore the signs. So if something feels wrong, talk to your doctor or a kidney specialist. Trust me, catching these issues early may make all the difference. In this amazing video, we learned about all the warning signs of toxic kidneys. But did you know that there are many ways to protect your health? Want to find out more? Drink these 12 powerful super teas every day to cleanse your body. Or watch 11 powerful ways to increase bile flow for better digestion. Watch one, or even better, watch both. What other signs of toxic kidneys do you know? Let us know in the comments below.